Mr. Investor Lot, welcome back to the channel. Today we're going to be talking about a very interesting company in the telehealth industry. So there is a healthcare SPAC that has caught my eye. Today we're going to be talking about that SPAC and ARK Invest. Oh yeah! As well as looking at the bigger picture. If you're new around here, my name is Miguel. Welcome to the channel. We look for big, juicy growth stocks. I want to 10x my money. I want to 20x my money. I want to 50x my money, baby. And always remember, this is not financial advice. This is for entertainment only. So now that I've introduced myself, let me tell you the ticker symbol. The ticker symbol is MOTN. So this is called Motion Acquisition Corp, and it's under $10 as we can see here. They are merging with a medical transportation startup called AMBULNZ, and it's valued at $1.1 billion. And after they merge, they're going to be called DCGO. So these guys are classified themselves as being in the telehealth industry. So when these guys first started out, they started out as an ambulance company, and what they were doing was they were delivering. These guys were giving you real-time GPS services to provide you with accurate arrival times and also peace of mind. So they offered total transparency. As we can see here, you can see which crew members are going to pick you up. They'll tell you what time they're going to come pick you up and what time is your expected drop-off. Then you can use your mobile device as well to track and see where you are or where your family member is. So when they first started off and they provided hospitals, patients and caregivers real-time vehicle location and accurate arrival times, didn't really think much of it, right? But now since its inception, they have expanded to offering patients in-home services, and they have 1,700 plus staff paramedics and emergency medical technicians. So these guys are trying to revolutionize medicine and healthcare. Telehealth Plus delivers the last mile of telemedicine. Telehealth Plus is one of the services they provide. So this is where it gets interesting. AMBULNZ's Telehealth Plus provides a non-critical medical service to patients within their homes, delivering the full promise and potential of telemedicine. This enables housebound and bedbound patients top-level medical services within the comfort of their own homes and the safety of their own homes. Every time you go inside a communal healthcare setting, whether that be a hospital or be a GP service, you increase your chance and risk of infection. Plus, for people with poor mobility, they have to go outside their house to go and get the care services that they need. However, with AMBULNZ, and it's going to be DCGO soon, so basically DCGO, you can get all the bedside procedures, including rapid testing, blood work tests, anything from pregnancy, strep, urinalysis, viruses, pre-op testing, pulse oximetry. You can even get wound care, and you can get ECGs from the comfort of your home. Not only that, but you can get blood pressure monitoring, you can get medications such as oral and IV intravenous. So imagine you need to go into a cancer center in order to get chemotherapy. Can you receive this chemotherapy at home if you are immunocompromised? Imagine with this service you can. You can also get your vaccinations from within the comfort of your own home. How crazy is that? So this really gives people access to all this healthcare with minimal stress, giving a holistic and improved, better patient experience. They state as well on their website that it lowers unnecessary hospital readmissions and ensures better patient compliance with discharge treatment plans. And they can also provide these services at a lower cost than physicians because they have a big staff panel of paramedics and EMTs, overall reducing the healthcare costs by limiting the inappropriate flow of patients to and from healthcare facilities. So these guys have also been making money during the pandemic. So during C19, this is how they helped out. So they've been working in partnership with MD1 Medical Care PC and top CLIA and CAP certified labs. They've delivered over 1.2 million tests completed, over 24,600 vaccinations administered, and they've been working with around 2,000 medical staff. So why would this make money? Well, the population's culture towards seeing the doctor is changing. This has been brought about by C19, and trying to visit our GP during this time has been super difficult. There's been absolutely horrendous waiting lists, and lots of people haven't had the ability to go and see doctors and get medical checkups that they need to during the pandemic. Also, there's been changes to funding and insurance coverage and changing consumer habits. So these guys were also featured on Fox News channel because you can see what they were doing during the C19 pandemic. Rapidly growing services.
Here in New York, there are thousands of New York City police and firefighters out sick as the city deals with this pandemic. Now the feds are sending ambulances and crews to help with a surging number of 911 calls. And Brian Yennis, live in Fort Totten Park in Queens, New York, and more on that. Brian, what are you hearing?
Hey, Bill. Yeah, we are in Queens. This is the toughest and the hardest hit area in New York, and reinforcements are on the way, and they have already arrived here to help New York City's finest. We were there this morning at Fort Totten right where they had the staging area where ambulances had arrived, dozens of them from all over the country, from as far as California, and they began deploying throughout the city. FEMA not only sending 250 ambulances, but also 500 EMT and paramedics to help out, and they need it right now. About 1 in 5 of New York's EMTs or paramedics are out sick or quarantined.
So before we go into the investors presentation, which we're about to go into, I'm just going to show you what's been going on here with the NHS in the UK. So we can see this article was published by hospitaltimes.co.uk, and on the 17th of February 2021 it was published. It says the NHS waitlists reach up to 10 million by April, and they state here that the NHS waitlists reach up to 10 million people by April. They're saying this is due to the following: pandemic disruption to elective healthcare and treatment referrals, and people are currently dying because of this wait time. Here you can see for lung cancer alone, 1,660 premature deaths are expected due to delayed diagnosis and treatment, because during this pandemic the NHS essentially became a national C19 service. So now they started to focus on community diagnostic centers for cancer, cardiac and other conditions, set up to restart screening programs halted by the C19 pandemic. And we can see here these guys are offering on-site clinics, so you can actually provide on-site medical services at facilities or venues. So presumably they could go into this kind of community setting. And you're saying, but hold on, how can they get in there? It's hard to get in with the NHS with a contract. These guys are already partnered with the NHS, the National Health Service here in the UK. As we can see here, they've already got their ambulances put in place here. And a lot of you are from America, so you can check out some of these guys. These guys are also their partners. And because I'm from London, I don't know how big this is. I've never been to USA, guys, so let me know if you recognize any of these guys. Jefferson Healthcare, Children's Hospital, Fresney Kidney Center, TriStar, Centennial Medical Center. So now Ambulance is going to turn into .go, right? So MOTN is going to merge and basically become .go as their ticker symbol and as a company. This is their investor presentation from March 2021, so it's very recent. Let's take a look. So these are the key highlights of the business I'm going to explain now, and then we're going to look at the last mile care industry and compounded annual growth. So first, let's look at the key highlights. 77% revenue growth, 70+% reoccurring revenue, 40% plus gross profit margin. They've got over 1,700 employed providers, and they've already had over 1 million plus cumulative patient interactions. In terms of compounded annual growth rate for their market, let's take a look here. It says steep innovation and revenue growth trajectory. You can see it's rapidly expanding to meet the market and this demand for last mile delivery of care. So for their market, they've expected annual revenues to be 48 million. Then it's going to expand 2020, 94 million. By 2021, they're seeing 65% growth to 155 million. And by 2022, 72% growth to $267 million. Overall, they're expecting a 77% compounded annual growth rate with a large increase for their telehealth plus business model. So if they're expecting this kind of growth rate, what's the next thing we should look at? Let's look at their careers page. And are they hiring? Oh baby. So I've never seen so many jobs crop up in one place. Let's take a look now. Really good reviews, baby. And then we go down here, we go to the career section. So at first we see administration, you see business development, a few jobs there, engineering, finance. And when we actually get into it, you can see here they're looking for so many recruiters. They're expanding their operations with loads of managers, loads of directors of operators. And then here is dispatch. So many ambulance, dispatch supervisor, ambulance dispatcher, everything from C19 test technicians, loads of emergency medical technicians. The list just keeps going and going, baby. Look how much they're hiring in different parts of the USA. It's just a crazy amount of jobs. Honestly, I could scroll down this page all day long. They're even hiring nurses, a whole load of paramedics. Oh my goodness, on and on and on. So yeah, I'm not going to sit here all day and just read out all the jobs they're going to have, but there's a lot of people that they're currently hiring. You can see here. So they must be expecting massive growth like they've stated within their investor presentation. So now some of ARC's analysts are really good. So let's take a look at what ARC thinks about telehealth industry. So this article is back from July 8th, 2020. Oh my God, it's Mr. Simon Barnett. I know a lot of bingo cowboys got some beef with this man, but let's just take a look and listen to what he's saying here about the telehealth care and virtual care industry, because I know they loaded up a lot of money into telehealth. So Mr. Barnett said, virtual care and telemedicine are critical to helping people maintain access to healthcare while not exposing themselves to infection. It's been a trend that's been held for the past 5 years, but it's clearly been brought up to the forefront, showing how exceptional virtual care can be, making people comfortable with the idea. So now he's talking about the industry changing in terms of people's consumer habits. So he said he pointed out the changes in people's habits in regards to seeing medical professionals in person, noting it's dangerous for high-risk people to have tests done in hospitals, hence more comprehensive diagnostic assessments can be done at home. Wow, that's what we need to hear. And he said this is gaining traction. So this is why I think that lots of telehealth is going to expand expand into this at-home treatment and at-home care, because although the vast majority of inpatient procedures and check-ins can be done through virtual care, as of right now, to get blood tests, to get certain tests done, you're still going to need a professional to come in and take it. So right now, ARK Invest always invests into innovation. So now they think there's going to be a lot of innovation, a lot of change in that field. So did they put their money where their mouth is? So guys, if you want to check out this site, Lucid Tracking, check my description box below. I track everything that ARK buys and ARK sells on a daily basis, and you can check their aggregates and ranking in terms of their conviction and their confidence. So yeah, Lucid Tracking has shown me here that ARK has actually put most of their money into Tesla in terms of how confident they are, the highest conviction stock that they have. And the next one on the list is Teladoc Health. As we can see here, $2.4 billion they've put into Teladoc. The telehealth segment is expected to experience growth of over 19%, and between 2020 and 26, this is going to happen. So what's the total market size going to be? It states here on Globe Newswire that the global telehealth market size was about $61 billion in 2019, and it's projected to reach $559.5 billion by 2027. This is a compounded annual growth rate of 25%. Woo! So that's why ARK has consistently been loading up on Teladoc throughout this C19 virus throughout the year, and even during this market correction and this dip, they started to load up even more. So every day they've been buying millions and millions, and as you can see here, 24 million, 14 million, $78.5 million in the last few days. So Teladoc is like the Goliath in this industry. That's the strongest pick and the bet of ARK, right? With revenues, their 2020 revenue expected to reach $1.1 billion, and in 2019 they had $553 million of revenue. They also delivered over 10.6 million virtual visits, so by the phone. But we can see here DOCGO, aka AMBULNZ, they're uniquely positioned to carry out a service. Is this for real? It looks like it's turned into a helicopter, baby, a drone. It's a tank drone. They also allow you to use them at events. So I'm going to show you some events down here. You can see there's Barclays Bank there. So it looks like they can provide their service at any big events. And as we see the C19 virus and the pandemic start to fade into the distance, we can see lots of these big arenas opening up, and perhaps they got a healthy revenue stream also coming from these. So right now we can see they're focusing on growth and expansion. They're hiring a lot of people, but when they start cash flowing, will they start to make selective acquisitions like Teladoc did when they bought Livongo? These are some of Teladoc's health consumers facing brands. You can see they got Teladoc there, they got Advanced Medical, they've got Best Doctors, Better Help, Healthiest You, In Touch, Livongo, and it's all about telehealth, telemental, and also focusing on chronic conditions. So these guys just started to eat up the industry. They started to buy all these subsidiaries because they can see that digital health presents a long-term opportunity and a big potential. So will DOCGO start to make certain acquisitions when they grow a bit bigger and when they get their revenue in? There's a significant total addressable market. You can see here 35 billion in last mile urgent care. They've got 35 billion in last mile home health services, 12 billion in the last mile medication administration market, and medical transportation market represents $13 billion too. So by offering all these services, including vaccinations, blood work, IV hydration, wound care, oral medication, mobile imaging, and ECGs or EKGs, they have so many different ways that they can make money and treat a wide variety of patients. They've also found that they have a cost advantage. So when you use EMTs and paramedics versus physicians and nurse practitioners, this is how much DOCGO is. As you can see in the blue, the cost per patient, and this is how much the industry average is. It's the white on top. Across the board, they can execute at a fraction of the industry average costs. So now let's look where they're based and what they've accomplished so far. So this is their footprint and reach. As you can see here, they are operating in 23 US states and the UK already. They're already licensed to actually operate in 29 states, and the license is pending in 14 additional states. There's less than 1% market penetration today, so there's a significant potential for upside growth. And these are the kinds of services that they're running currently. In the UK, it's mobility only, but their telehealth plus only services are here in the blue states, and the green states are mobility and telehealth plus. They have some major key relationships and partners. So you can see here telehealth plus relationships, all of these companies including the NFL. There is also Uber, Blades, Barclays Center. They've even got HBO in there. Now in terms of these, the world-class partners and joint ventures, some of you guys may know these names. And apparently Jefferson Health Hospitals offer an extensive care network through our offices through Pennsylvania and New Jersey. So these are one of their partners, and they're based here with 14 different hospital locations. And in the next slide, they're stating that their joint venture partners can help drive their predictable growth. So they're working with Fresenius, as you can see here, with over 2,600 dialysis centers on their books and 205,000 patients. Jefferson, as we just mentioned, we've got a leading real estate owner and operator in New York, RXR, and the #1 healthcare system in Colorado, UC Health. So down here on the bottom is very interesting here. DOCGO is in advanced talks with several large hospital systems and national healthcare companies to expand its joint venture partnerships. So it's offering them a $500+ plus million per year combined revenue opportunity, an evergreen contract structure, so you need to give them a multi-year cancellation notice period. They've got highly reoccurring and predictable revenue, and the joint ventures are actually giving them a national footprint across the USA. So they're stating that they've got several large hospital systems and national healthcare companies. These deals are still yet to go through. These are still in the pipeline. I'm just thinking, what can this company grow? Can they be disrupted? Are the other telehealth companies going to outgrow them and try and consume part of this market as well? So before we finish off, let's take a look at the financials. Let's look at the predictions and the predicted revenue. So here we can see for their mobility solutions, they've got a revenue model where they get fee per trip times the trips per shift. So this is a base rate plus loaded miles and per mile rate. And then in terms of their telehealth plus solutions, they've got contractual established relationships with healthcare providers already. This is going to give them consistent demand for services. So these guys make sure that they collect fees for solutions and fees for service. Attractive reimbursement mechanisms and payer mix. Take a look at this. This is really important. Established Medicare fee schedules, providing them with visibility and predictability into expected payment across the majority of the business. So they have contracted rates with municipals and corporates for majority of existing telehealth plus business. And take a look at this. For mobility, we see 51% covered by Medicare, 10% covered by Medicaid, commercial or other is 20%, facility is 16%, and patient is 3% for mobility solutions. Now for their telehealth plus solutions, you see patient 1%, a municipal or other pays 63% of it, the facility 23%, corporations 13%. In terms of their operation costs, we can see here, come to this slide, lots of it is fixed. So this whole part here, their labor cost, the lease and other is fixed. The things that fluctuate is its fuel maintenance, the billing, medical supplies and dispatch, but that's the variable you can see here in the light blue. They are also expecting that margins in terms of gross margins and percentage, it's going to grow. So currently they're looking at mobility 41%. They're stating overall totally they're going to have 51% gross margin. And they expect that their margins are going to improve significantly as operations mature and are optimized. So if the telehealth industry is projected to grow by 2027 to $559 billion, I think it may even be more. What's the chances of these guys getting a small slice of that pie and making some money? Especially when they're expecting revenue growth like this. As they continue to compound and they continue to optimize their operations, as well as get greater contracts, can these guys make a lot of money? So guys, as always, hit me up with some comments below, bounce some ideas around, tell me if I'm wrong about anything or if you spotted any mistakes or if you can see something that is masking the industry. Let me know your thoughts and feelings as always. If you're able to support my channel, you can click here, it's only 99 cents. It helps me to create great content like this. Or even better, if you're able to join our Patreon group, we're actually creating the Discord group where we talk about all the juiciest growth stocks, and you can see the companies that I currently have my eye on, companies that I want to cover. I'll also let you know if I'm going to be buying or selling any stock, but generally it's going to be a fun place where we can do due diligence and research together and just bounce ideas off each other. You can join absolutely any level. I'm going to let you guys into the Discord group. As always, thank you very much for watching. I appreciate you guys. Mr. Invest a Lot, over and out, baby.